This vaccine equity video series is produced by the Public Health Alliance of Southern California. Our series elevates promising and replicable practices for equitable vaccine distribution. Practices happening both here in California and across the nation. Our video series will showcase community-informed and equity-centered practices that specifically aim to reach disproportionately impacted low-income communities and communities of color. My name is Marley Williams, and I am the Health Equity and Justice Manager here at the Public Health Alliance of Southern California.
And I'm Dana Sherrod, Birth Equity and Racial Justice Manager for the Alliance. The Public Health Alliance of Southern California is a coalition of the 10 health departments here in Southern California. Collectively, our members represent 60% of California's population.
In this video, we speak with Jake Fitzamanu, co-founder and board member for the Utah Pacific Islander Coalition and program manager with the Utah State Department of Health, and Isabella Lisa, community health worker with the Utah County Health Department, as they discuss the importance of disaggregated data and culturally grounded efforts in reaching Pacific Islander community members in vaccine distribution.
Could you tell us more about your efforts to reach Native Hawaiian and Pacific Islanders in vaccine distribution in Utah County?
Promotion for our events completely comes from our community partners, such as the Pacific Islander Health Coalition. The flyers will be sent out on Facebook, usually with our community partners, Tongan American Society, Samoan and Tongan LDS church wards, and education as well will come out from those community partners. And I think people underestimate how important it is where their information comes from. So although we're sharing the same information from the state and the county health departments, having it come from a community partner is so crucial for our Pacific Islanders. And then the day of, making our vaccine events a comfortable environment and welcoming for our Pacific Islanders looks like having Pacific Islanders at the front desk, checking people in and greeting them in language or in English. It looks like having people check them out and say goodbye to them and let them know that we're happy that they came. Working with community partners, even outside of the Pacific Islander Health Coalition, at colleges here, and just letting them know that we are a trusted partner and that we are working closely with the people who they trust. That makes a world of difference to our community.
What has been the role of the Utah Pacific Islander Coalition in your vaccine distribution efforts? And how is the Pacific Islander Coalition really working with the health department in partnership with health departments to reach Pacific Islanders?
In the state of Utah, Pacific Islanders and our Latinx communities have been the most or the hardest impacted communities. And so when it comes to allocating these resources, this is the role that the Health Coalition can play in making sure that counties and the state government are providing equitable response and allocation to those needs. And so I think one role or one collaborative role has been to ensure that Pacific Islander voices are at these decision-making tables. We're very blessed to have folks like Isabella down in Utah County who can speak there. Dr. Saya Hafoka, who's our public health director for diversity here in Salt Lake County Health Department, myself and others, many others who can provide voice and make sure that we're raising the flag and standing up for Pacific Islanders, which are, as at a state level, 1 or 2% of the state. It's a very small population, and yet the disproportionate impact has been huge in terms of infection rate, hospitalization, and even mortality rate. And so ensuring that our voice is raised and that these doses are being allocated and that partners are being lined up to assist us where we don't have mobile operations and we don't have, we're not approved vendors or providers for the vaccines directly. So we have to work with the counties, we have to work with other private organizations to make sure that that comes our way, and not just to wait for the state or wait for the county to help us out, but be proactive and really go after those resources and hold folks accountable for the equity in that distribution and allocation.
Tell us a little bit more about the success of your efforts. How How is this community-based approach really translating to good outcomes for you all?
In terms of success, the things that have been mentioned that Isabella has talked about, some of the ways that we've tried to work to promote and to bring people in and make these events accessible by holding clinics at churches, at Pacific Islander charter schools, at in venues that folks are comfortable with, that they trust with, finding trusted messengers and working with our media partners to provide public service announcements in Samoan and Tongan and Marshallese, and disseminating them through small media sources has been really a key to that success. There have been weekly clinics that have been held, sponsored by and co-hosted by the different chapters of the Pacific Islander Health Coalition since February 6th, every single weekend. And so this is we've had all the way down in southern Utah, in St. George, which is closer to Las Vegas than it is to Salt Lake, to Utah County and Salt Lake County, where 70% of our Pacific Islander communities reside, and the northern part of the state. We've had partnerships to provide vaccines there as well. Cultural responsiveness piece is key. Again, whether they're hesitant or whether they just don't have much opportunity, making sure that we're providing consistent engagements at trusted places at different times of the day, for example, in the morning and also in the afternoon or the evening, providing, food. We've had congregations or other groups that have actually barbecued outside of the church and provided free lunch for those that came in, kind of as an incentive, but also that's just our cultural way of doing things. When we invite guests, make sure that folks are fed, make sure you go home with a swag bag. And, that 15-minute waiting period after you get your dose is not a lost opportunity either. And our community groups are making sure that folks are being provided with swag bags and resources, not just about the vaccination and potential side effects, but about other programs and about other health disparities and about other wraparound services that they can also access while you're waiting in your car, after your shot, before you take off.
So if there were another local or state health department that were interested in replicating, you all's efforts and specifically, reaching Pacific Islanders, what would be some of your key recommendations to help them be successful? And also, if you could share any other lessons that you learned that you would, want other folks to consider.
On top of the, cultural responsiveness pieces that have been really well touched on, and the absolute critical nature of community health workers from the community that speak our languages, that represent the community well. I would also say that another tip or another crucial piece for the success that we've had here, which also provides a way to evaluate how well we're doing, is really having strong data and a really strong empirical evaluation piece there. That starts with disaggregating Pacific Islanders from Asian Americans. And fortunately, here in our state, that wasn't an issue. Our health statistics are already disaggregated, but we have a handful of states right here in the Intermountain West that we still don't know exactly how many Pacific Islanders have been impacted by COVID, or how many are being vaccinated right now, because they're still being lumped together and aggregated with Asian Americans. And that's not helping our community or the Asian American community when we do that. And so we're fortunate, and that would be my big tip for any community or municipality or government agency that's looking to replicate this. God forbid we ever have another pandemic in the future, but that's a big lesson learned here, is having that data and being able to get very granular and see how folks are actually being or receiving the vaccinations that they need. I think that one thing that Utah did fairly well from a state government perspective was not just to utilize the Multicultural Commission, the task force that Bella had mentioned, and the other ad hoc groups that were convened to address vulnerable populations. but actually inserting Pacific Islander indicators into the central response plan and having that brought up on a weekly basis at central command meetings and setting goals for reducing percent positivity or increasing testing, and then now with vaccination. And so having those indicators brought into the central plans at those very central policy-making tables and decision-making tables, I think is a big deal.
Curious from your perspective, like what is the next step for you all in terms of what is needed as you're moving forward and you're trying to close that gap in terms of the disparity in vaccinations for your community? What else is needed? Where would additional resources serve you well, or where would additional support serve you well, either from the local health department or the state health department?
Another thing I think is super crucial for continuing this work in our community is just staying consistent with the mobile vaccine events and other efforts. So consistent assistance from the county health departments and from the state health department on getting these doses for the events and advertising these events to our communities so that they know it's something that they can depend on and spread the word about, and it'll still be there for them. I think that would make a huge difference.
Continue this infrastructure that's now been created to respond to an unanticipated pandemic, but use these lessons learned in this infrastructure for community health efforts, for diabetes, for obesity, for other chronic health conditions, and everything else. This has been a really interesting learning experience that has really taught us that, we shouldn't have to wait for a pandemic to really be able to mobilize communities and provide allocated resources. And we've also learned that, when people say, well, the budget is tight and resources are tight, well, they pulled out the stops on this one. So if they can find personnel, they can find funding, they can find resources, and we've caught up to that as well. And so I think, just like Bella said, continuing the same level of engagement and mutual support and resource allocation would be fantastic, and expanding that to other areas of health and other sectors of this broad definition of health besides just pandemic response.